Welcome to our platform, where medical topics are made easy. Prostate cancer is one of the most common cancers in men, and while it's scary, knowing the warning signs can make all the difference. After all, when caught early, it's often treatable. But here's the problem. Early-stage prostate cancer usually has no symptoms, so how do you know if something's wrong? Today, we're breaking down the warning signs, risk factors, and when to talk to your doctor. If you find this helpful, be sure to share it with other men. First, let's talk about early-stage symptoms. In its earliest stages, prostate cancer typically doesn't cause noticeable symptoms. That's why screenings like the PSA blood test or digital rectal exam, DRE, are so important, especially for men over 50 or those with risk factors. But as the cancer grows, it can start pressing on surrounding tissues, leading to changes like urinary problems, pain, and blood in urine or semen. We'll unpack each of these next. Urinary problems. So you might be thinking, hold up, urinary problems happen to everyone at some point. What's the big deal? Well, when it comes to prostate cancer, specific urinary issues can raise red flags. These include frequent urination, especially at night. Picture this. You're in the middle of the night several times, not just needing to go, but actually having a hard time starting the flow. That might be more than just needing to pee more. Next, weak or interrupted urine flow. Think about when you go to urinate. Does the stream seem thin, or do you feel like it's sputtering or starting and stopping? That could be another sign. Then there's pain or burning during urination. A burning sensation or pain when you pee isn't typical. It might signal an infection. But when it comes to prostate issues, it's worth checking out. Lastly, difficulty starting or stopping urine. Does it feel like you're not completely emptying your bladder? Or perhaps you find yourself starting and stopping the flow multiple times. All these urinary issues are not only annoying, they're potential signs that something isn't right with your prostate. It's essential to take these seriously. While many things can cause these symptoms, like an enlarged prostate or infection, prostate cancer should be on the list of possibilities. Pain. As prostate cancer progresses, it can cause discomfort in the area around the prostate. Now, not every kind of cancer is painful, but with prostate cancer, you might experience pain in the lower back, hips, or pelvis if the cancer has spread to the bones. Discomfort in the testicles could also indicate a problem with the tubes that carry sperm. Blood. Seeing blood in your urine or semen can be alarming, but it's essential to pay attention to this symptom. Blood in the urine can be a sign of several issues, but when it comes to prostate cancer, it's a potential red flag. Similarly, blood in the semen can indicate problems with the prostate or other reproductive organs. These signs don't automatically mean you have prostate cancer, but it's crucial not to ignore them. Erectile dysfunction. Erectile dysfunction, or ED, is the inability to get or maintain an erection firm enough for sex. It's not just a problem for older men. While many associate ED with aging, it can also be a side effect of prostate cancer and its treatments. As the disease progresses, it can damage nerves that control erections. This damage can lead to a less than satisfying sex life, which is already a challenging topic for many men. But when it comes to prostate cancer, ED might be more than just a physical issue. It could be an indication that something's wrong, unexplained weight loss or fatigue. Prostate cancer, like many other cancers, can cause weight loss and fatigue as it progresses. Changes in appetite or sudden unexplained weight loss can be a sign that the body is struggling with more than just everyday life. Additionally, persistent exhaustion that doesn't go away with rest could also hint at underlying issues. While these symptoms can be concerning, it's important to remember that they don't automatically mean you have prostate cancer. Many conditions can mimic these signs, but that's exactly why it's so important to stay vigilant and proactive about your health. So who is at higher risk of developing prostate cancer? Age. Prostate cancer is uncommon before age 50. But the risk increases significantly after age 60. However, it's important to note that many cases are found in men over 50 as well, so it's not a clear-cut rule. Rather, it's a reminder to start paying closer attention as you age. Family history. If you have a father or brother who has had prostate cancer, you're at twice the risk. Genes play a significant role in many cancers, including prostate cancer, so having a family history is a potential red flag. Race. Unfortunately, Black men face a higher risk of prostate cancer than other racial groups. This disparity is concerning and highlights the need for increased awareness and access to healthcare within the Black community. Diet. Some studies suggest that a diet high in red meat or dairy products might increase the risk of prostate cancer. However, this link is still being investigated and not fully understood. It's important to remember that while these factors can increase your risk, they don't determine your fate. Prostate cancer can affect anyone, regardless of age, family history, race, or diet. So when should you see a doctor? Don't wait for symptoms to worsen. Seeing a doctor sooner rather than later is key. Here are some situations to watch out for. Persistent urinary changes, even those seemingly unrelated to your daily life, might signal something more. Blood in the urine or semen is a potential red flag and should be checked out immediately. Unexplained pain, whether in the urinary area or elsewhere, might be trying to tell you something. Are you experiencing a new pain that you can't quite explain? Don't shrug it off. It could be important. For many men, discussing their health can be intimidating, but it's essential to take charge of your well-being. Screening tests, like the PSA blood test and DRE, can detect prostate cancer early, even before symptoms appear. If you're over 50 or 45, if you have risk factors, it's time to start the conversation with your doctor. Early detection makes all the difference. Don't ignore the warning signs. Your body is trying to communicate with you. It's up to you to listen. Knowledge is power. Sharing what you learn about prostate cancer with other men can help them stay vigilant, too. Together, we can fight back against this disease. Remember, there's no need to panic, but there is a need to pay attention. Stay informed, stay curious, and above all, stay proactive about your health. Because understanding the signs of prostate cancer is the first step towards prevention and early detection. And if you want to know more about supplements, click here. Thanks for watching. Like and share for more.